Hi everyone, welcome to the community classroom. This is Dr. Tracey McCarthy, psychologist, attorney, and educator. We're going to be shifting gears here. We're going to be talking about science on trial versus history on trial. This is a very necessary direction that we're going to be going in, and it is related to many things that are relevant with respect to current situation and just simply going forward in life. And so at times you have to pick and choose what is most important and what you need to focus on. And right now there is a need to focus on wellness. There is a need to focus on growth and health and moving forward. And there's also a need to focus on information and knowledge, practices and processes that are going to be beneficial for the next generation. So we're talking about the children. The children need more assistance. The children need more help. The children need more information. Ultimately, adults have access to a lot of information, and the educational systems are not meeting the children where they are right now and bringing them to where they need to be so that they are prepared for the future. And so this direction is twofold in terms of purpose. This is to explore some important information for adults, but also to give people an opportunity to incorporate children into the discussion. You can use these discussions for homeschooling. There are many lessons that you can use in terms of outgrowth from what we're going to be talking about, some of the topics we're going to be talking about. And so you can just use any portion of that and adapt it for a homeschool lesson or a supplementary lesson in terms of whatever the children are learning in school right now. And you can go in so many different directions, just taking one issue and really digging deep with respect to that issue, or going broad with respect to that issue. And so you can address a number of academic topics, even with something as simple as aspirin. So what we're going to be doing right now is we're going to be putting science on trial. There is a lot of focus on science. We're going to quickly talk about what science is and what science is not. And the question we're going to be looking at is aspirin antimicrobial? And that means against microbes. And so the question is, does it have the capacity to attenuate microbes, the action of microbes, the process of microbes, and the consequences of infection with respect to microbes? So let's get started. So with respect to this aspirin question, we're going to be focusing on the science. Science basically means know. That's it. It means knowledge. And so you've been subjected over the last year or so to a great deal of feeling. And so you've had those who are identified as scientists, not always presenting science, meaning knowledge. There has been a presentation, sort of a parade of presentation of feeling. And we're not talking about psychologists here, so we're talking about hard scientists. And so you should be treated to a buffet of science, meaning their research and the other research that is actually out there, whether it supports what they are talking about or it counters what they are talking about. And a good scientist, as with a good attorney, those individuals know the science for and against, or the theory for and against whatever it is that they are talking about. And so it is important for you to be respected as an audience, as a recipient of the information. You need to be respected by being provided knowledge, the science that people are talking about, and not all of this feeling. And so we're going to delve into a research article about this particular question, and we're going to start off with some information about what aspirin is so that you get a better understanding of that first. And as we go into this, we just want to reiterate about this idea of knowing. It basically means recognizing and identifying. Many people don't think about the fact that everything that we have came from nature, even if it is synthetic. It originated in nature. So no one has created anything new. People have simply taken whatever was there and adapted it. It doesn't matter who the scientist is. They have not created anything from scratch. Because only the creator has created from scratch. And so people are working with things that are already there. And in this case, we're talking about the attributes of the willow bark tree. So we're talking about the willow tree and the bark of it and how it produces a certain acid that is the precursor to aspirin. And so we're going to be looking at some information out of an actual article. And here you can see that this piece is talking about salicin and salicylic acid, and they are found in the bark and leaves of the willow and poplar trees. This is helpful because there are lots of willow and poplar trees in the United States. If you live somewhere else, you might want to check to see if you have these types of trees wherever you are located. Now, historically, ancestors didn't have access to the level of medical care that people have right now. And so they had to depend on things that were in the raw form versus the manufactured form where things are put together. So they had to put things together themselves. And what's noted about this particular tree and the attributes of this tree is that the substances from the tree have been historically used to treat malarial fever. Also, these things have been noted to address pain and inflammation. And basically, that's what aspirin does. It helps with pain and with inflammation. And here's some more information about aspirin, just in case you don't know, because you may see another name and not recognize that the active ingredient is this aspirin. And so there are a number of other names that you can see up there. I'm not going to be giving advertising to any of them, but you can look at them and see for yourself. And here's additional information about what aspirin is and how it works. And it says it works by reducing substances in the body that cause pain, fever, and inflammation. Now, microbes are known for inducing inflammatory states as the body works to rid itself of the microbes. And microbes include bacteria, fungus, viruses, mycoplasma. Now, there is a warning here about the use of aspirin, and you should pay attention to this, but there's also a warning at the end that you need to consult with your wellness partner before undertaking any of this. And there's also an admonition about not giving aspirin to children or teenagers with fevers and flu symptoms or chickenpox because of complications that may grow out of that. And so what's important to note from this discussion, the crux of it is about the antiviral activity of aspirin against certain types of viruses that impact the respiratory system. Now, this is about an in vitro study. You might hear the words in vitro and in vivo, and it's important to pay attention to those words. In vitro is basically the laboratory. In vivo is about real life, and so you're talking about real people. And so this is a laboratory study that is being discussed here. And this information is available on the NIH PubMed information website. And so here you see the results of this study. And they indicate that aspirin was found to be highly effective against influenza A, H1N1. And it showed antiviral activity against all human rhinoviruses. And so this is very important in terms of this research. And so you see that according to this particular research, that aspirin was efficacious with respect to its antiviral activity, with respect to some highly problematic viruses that impact respiratory functioning every year, all year. And so this is important to note. And so there is also a conclusion that you need to make note of. And so they are saying that how this takes place is unknown. They know that it's effective, but they are not clear about how it is effective. And there's also the need to look at the efficacy in vivo, meaning in real life with real people. However, this is important information to have, and you can consult with your healthcare provider or your wellness partner regarding this particular finding. You're also encouraged to do a little bit more research for yourself so that you have a better understanding of how aspirin may be operating in relation to microbes. And so as we wrap this up, you are encouraged to discuss this with your wellness partner. This is for educational purposes only. It does not constitute healthcare advice. And if you need healthcare advice for your individual wellness and healthcare, you are encouraged to contact your individual healthcare partner. As we always say, knowledge is power. It's also important to know what knowledge is most helpful at what time, what knowledge is most important, and what knowledge is most empowering.